First, let's check in with Gabe Gutierrez. He's in Des Moines, Iowa, a state where the governor has now reversed her opposition to mask mandates as the state faces a runaway surge in cases. Gabe Gutierrez, what was interesting about Governor Reynolds is that she mocked those that asked for a mask mandate a couple months ago by saying, oh, it would just make people feel better. She has since flipped, and she is somebody who people tell me that data does matter to her. So clearly the hospitalization situation in Iowa is at a breaking point.
Yeah, that's right, Chuck. The State Department of Health just a couple of days ago recommended that the governor issue that partial mask mandate. And as you mentioned, earlier this year, she had talked about it being mask mandates in general being, quote, feel-good measures. But still, there are some critics here in Iowa that feel that these new restrictions don't go far enough. But Chuck, you mentioned that I was in Des Moines. Actually, we moved from Des Moines about an hour outside of Des Moines. Earlier today, we had spoken with doctors and nurses who were worried that their ICU capacity was already full, that they had no more space. Well, now we're here at a more rural hospital in Knoxville, Iowa. This hospital has no COVID ICU. They have a limited number of beds, but they are very worried about what the coming weeks and months will mean. I'm actually joined now by the CEO of Knoxville Hospital and Clinics, Kevin Kincaid. Thank you so much for joining us. We're here outside of your emergency room. This is actually a helipad where patients are brought in and potentially taken out. What is the situation inside this hospital right now?
So first, thank you for telling the rural story. Appreciate you being here. But as we currently sit, we have thankfully been blessed to be able to meet our community need, but at the thinnest of margins. We just really don't have the capacity for any more of an upsurge. And our rural or our metro partners that we would refer to for higher levels of care, their critical care beds are redlining as well as ours.
So Kevin, help me understand here. You were telling me earlier that it's not just an issue of space, but it's an issue of funding. What had happened earlier this year, community hospitals like this in rural areas were really decimated because they couldn't do elective procedures anymore, and their operations were limited earlier. How is that affecting you now, and how will that affect you over the coming weeks?
Yeah, it's been a very difficult financial situation for healthcare in general, but specifically to rural hospitals. They were already operating at very thin margins, and then when we were shut down from routine care and elective surgeries, that just shut off our economic lifeline. And so here in Iowa, in rural Iowa, we were shut down for routine care, but we didn't have, the virus wasn't here. So everything was kind of hypothetical at that time as to what would we do if there was an upsurge. And now the virus is here, and we're back to busting at the seams, which again has an impact on routine care, elective surgeries. And so it is a very tough economic situation for all rural hospitals.
Kevin, thank you so much for joining us here. Again, Chuck, we're here in Knoxville, Iowa, about an hour outside of Des Moines. And this could be a very dangerous situation in the weeks and months to come, not just here, but at rural hospitals really throughout the country. And Chuck, the CDC estimates that the COVID death rate in rural areas is more than double what it is in non-rural areas, Chuck.
Hello, YouTubers. If you're watching this, it means you've checked out our channel, so thank you. Now do me a favor, subscribe by clicking on that button down there. Click on any of the videos to watch the latest interviews and highlights from MTP Daily and MSNBC. You can get more Meet the Press content every morning in the First Read newsletter. If you're tired of content that you don't know anything about where it came from, you don't have to have that problem with us. NBC News, MSNBC, MTP, and the Meet the Press mindset right here for you on YouTube. Subscribe now.